Hi, my name's Mike Bergeron. I was the first COVID-19 patient confirmed at St. Tammany Hospital.
My name's Ray Lebrano. I was a COVID patient.
My name is Wesley Doyle. I live in St. Tammany. I'm a police officer on the South Shore, and I am a COVID survivor.
Had a great Sunday afternoon. Sunday evening, came home, felt fine. Went to a leadership meeting at church Sunday night, felt fine. Got home about 8:30 or 9 o'clock. By 10 o'clock, getting ready for bed, everything hit. It was really like a light switch.
I was painting the kitchen cabinets, and that Sunday was it that Sunday?
Sunday's when you got sick.
Sunday, I told her I got to take the day off. I mean, I'm just hurting.
Almost exact words were, "I hope this isn't a fluke, but I have a temperature of about 100."
A primary care physician, he was unavailable, but his nurse got on the phone. She spoke to me for a moment. She said, "Give the phone back to your wife. You're in respiratory distress, if not failure."
The feeling felt like I had glass all over my body, in my lungs. It was awful.
After that 2 days of kind of leveling off, that's when I started circling the bowl. It got really bad.
And the seriousness started to kick in at that point. When they took me out of the emergency room, I was in and out a little bit on oxygen, but I could hear them clearing the hallway for me to come through. And at that point, it really started to soak in. This is serious business. This is serious business.
They take me in, and I don't remember a whole lot after that.
I basically begged my wife to bring me to the emergency room. I couldn't breathe. I was out of it. I didn't know what was really going on. So she did. She brought me to St. Tammany Parish after that.
I really believe in my heart of hearts that through prayer from members of our church and our family and folks around the country who were alerted and prayed for me, that a medical team was assembled at St. Tammany that was just off the charts in terms of their compassion, their focus, their readiness to serve, their self-sacrificing nature.
Keep going, you're going to keep fighting, and others, they had their own way of, kind of bringing me out of that hole, whether it was sitting in there holding my hands and just talking to me for a while. They all did great.
The nurses are my angels. Doctors are great. Doctors do what they do. They're very smart people. But the nurses, you get that personal feeling, and I'd love to give a shout out to several of them. They were wonderful, because I was almost at that point. It's Olivia, Sydney, Sharon, Kim, Courtney, Christy, and Brittany.
Those people are remarkable. When I found out that they were all volunteers, they volunteered for those services, I was just taken aback. They put themselves on the back burner. They put their families on the back burner. They put their personal well-being on the back burner so that they could take care of people like me.
They have feelings. They're not, they're not machines, even though they're working like machines. They're working 7 straight 12-hour shifts. It takes a lot to do that, and I don't know if anybody really understands how taxing that is unless they've been in that situation where you've worked consecutive 12-hour shifts. It's very difficult, and they're doing it.
It really is a medical village, and I pray that those folks feel the same sense of appreciation from those of us who've been through this as the folks who are on the front lines, as we call it. Because in point of fact, they're all on the front line.
Yeah, if it wasn't for them, I'd be dead. They saved my life, and as corny as it is, I appreciate it more than they'll ever know, and I'm more thankful than, I can't thank them enough for everything they did, I can't.
Guys, we can't become complacent with regard to this stay-at-home notion. We can't. If we do, we're in for a lot of trouble. Take it seriously. Stay home. Our government's in control. They'll let us know when it's safe to get back out because they work closely in conjunction with the CDC and the entire medical community. I know it's hard. I know it's been a long time, but you have to stay at home. Take every precaution. I've been there, and trust me, you don't want this.